much, Hala, for the introduction. Thank you all for joining this webinar. As Hala mentioned, I will be speaking on the macroeconomic environment that is determining the context in which this study has evolved. So I'll be discussing both the global environment that is affecting the economies of Lebanon and Tunisia, and we're going also to discuss a bit the household level trends and observations that would impact food security in these two countries. So first, the context of the presentation will first include the background and the summary of the main messages. Then I will be discussing the country's background very briefly. Then we will move to discuss food supply and availability trends, issues in economic policies and regulations, and then an analysis of affordability and vulnerability to price shocks in both countries. What were the impacts of these price shocks and trends in the macro environment on consumption of key foods related to non-communicable diseases in both countries? And then I will conclude with some policy recommendations. First, about the study. So, as Hala mentioned, this is a study about food environments related to urban areas in Lebanon and Tunisia covering the last 5 years. It contains an analysis of the local socioeconomic and regulatory factors which amplify the two economies' large exposure to global price shocks and changes in global food supplies. The main messages of the paper are basically that first, the two countries have witnessed and are still experiencing large dependency on food imports due to historical policies which led to the deterioration of the agriculture sector's productivity. The second main message is that both countries, although they're kind of different in size and population levels, but they still suffer from monetary issues and local currency devaluations, which were pressuring the small farms and leading to a persistence in the food trade deficit. And the last main message is that the increases in food prices and availability of cheap, unhealthy, and highly processed foods in the market resulted in changes in the consumption levels of key foods related to non-communicable diseases risk, which we will show some data about that later on in the presentation. So first, with some background about the countries, for those who know little about them, but also for those who want an update about the situation. Let's start with Lebanon. Lebanon is a very highly dense country with a population around 6.1 million of residents. That includes one of the highest refugee shares in the world. Around a quarter of the population are Syrian and Palestinian refugees. The country has witnessed lately a political, economic, and financial collapse, which has amplified informality levels. The rate is almost 80 to 85% of the labor market is in the informal sector. It has affected poverty rates, which have skyrocketed from a pre-crisis rate of about 35% to a current poverty line of poverty incidence of 80%, below the national poverty line. The currency lost since 2019 96% of its value. The GDP has contracted about 67% in the last 3 years. And the society right now is highly dependent on cash transfers, mainly from immigrants and the diaspora and foreign aid. And also the population is highly vulnerable to price shocks and to deterioration of its purchasing power. And you can see in the small table on the slide some basic statistics about the economy and society of Lebanon, which, it has a small arable land, 13%, very small agricultural sector, and high dependence on trade for securing food supply. Tunisia, on the other hand, has seen not a collapse, but a weak economic performance since 2011. And most recently now, if you follow the news about Tunisia, there's a lot of issues with foreign currency reserves and talks about joining or not an IMF program. There's a high unemployment and informality rates not as much as Lebanon, but they're still very high. The national poverty incidence is about 17%, and unemployment is also between 17 and 20%. Public debt to GDP has doubled in the last decade, and there is a high trade deficit and decline in agriculture share of GDP. And since Tunisia has implemented subsidies to support the population, these subsidies have become increasingly costly since there is a currency devaluation and high dependency on foreign trade to secure also some basic commodities. Turning to food supply and availability, in Lebanon, the Lebanese market is dependent on imports to satisfy up to 80% of the country's food needs in any given year. Although agriculture imports have decreased recently because of the deterioration of the local purchasing power, and exports have substantially increased because of the local currency depreciation, still the balance of trade in agricultural product has witnessed a deficit of about $1.3 billion in 2021, about 56% of the total imports, the figure of the deficit. Why is that? Because the agricultural sector basically has collapsed and continues to experience a lot of problematic issues, mainly linked to deteriorating public services, specifically due to the very high energy bill, lack of water access in most agricultural lands, and systematic problems that were amplified by the recent crisis. Also, the food supply sector suffers from very high concentration in production and distribution. Sometimes in the retail sectors, not more than 3 to 5 companies would control entire market segments. While in Tunisia, the main feature of food supply is that the agriculture sector lacks official support, productivity, and investments. And Tunisia has some kind of self-sufficiency in some products, but still for cereals, it relies on imports to meet 60% of its local demand. And also we can see a trend in how the food is being made available to the population through the retailers. And we have a high incidence still of small grocers in Tunisia, up to, if you see here in the graph, up to 60% of staple foods are sold in small grocers, in local small grocers in Tunisia, compared to not more than 20% in Lebanon. Why is that? Because Tunisia has still 30% of population that is rural, while in Lebanon is only 10%. So the fact that we have still a large amount of people living in rural areas, you have small grocers that continue to occupy a central role mainly in these areas. We've also gathered in the paper some of the main issues that characterizes economic policies and regulations related to the food sectors in both countries. In Lebanon, we have problems almost everywhere, but we have a lack of national employment policy and regulations for migrants, and institutional fragmentation in all the institutions that are around food supply and distribution. We have also institutional incapacity, made more problematic by the fact that public sector workers in these institutions earn their wages like 95% of the Lebanese population, of the working population. They earn their wages in Lebanese pound, and they've seen their purchasing power with the devaluation suffer substantively. We also witness in Lebanon lack of agricultural financing. This is structural but made more problematic after the crisis. Lack of adequate safety nets for households, and also limited coverage of social security, which also is denominated in the local currency and has also a lot of internal debt that is basically stuck money that is deposited in the local banks and the central bank and in treasury bonds, and that's basically almost evaporated there. Turning to Tunisia, in terms of the regulations, we have an incomplete new food laws application. So although there was a new food law that would govern food production and trade, a necessary component with increasing the trade with the EU, the application has been incomplete. There is a lack of transparency and visibility in food trade and security legislation. There is a water strategy that is not completely applied yet. Very high informality in the labor market still. Challenges in social protection and the systems governing cash transfers to needy families, and a major issue around collectively owned lands and securing property rights for these lands. Now, turning to affordability and vulnerability to price shocks. As you can see here on the graph to the left, we have witnessed globally an inflation in food prices because of COVID supply chain issues, followed by the Russian invasion of Ukraine and the bottlenecks around production, an increased cost of transportation. All of these resulted in the FAO food price index increasing from a level about 60% in just 3 years. And this has translated into food price inflation in Lebanon and Tunisia, because they're highly dependent still on food trade. As you can see, the graph for Lebanon, inflation has been skyrocketing, specifically for food products, while in Tunisia, inflation has increased by about 30 to 40%, which by Lebanese comparison is not much. The population has been highly vulnerable to these price fluctuations, and the current situation in Lebanon has amplified these price transmission problems, and the high informality and precarity in Tunisia has meant that any price increase would be felt very badly by the population. Now, what were the impacts of all these trends on the consumption of key foods? And here by key foods, we mean those that are related to non-communicable diseases risk, specifically related to the food diets. And we have witnessed, both in Lebanon and Tunisia, dietary shifts away from fresh fruits and vegetables, specifically around the school-aged children, away from healthy diet into more processed and cheaper foods. And this trend has been global and affecting low and middle income countries the most. But we've seen it remarkably in Lebanon and Tunisia. And as you know, these dietary shifts have resulted in higher risk factors that Hala mentioned earlier, mainly the increasing rates of overweight and obesity among the general population, but also among the school-aged children, which ultimately would result in high rates of mortality, which is attributable to dietary composition, specifically due to NCDs. So let's look at some numbers. So the Global Dietary Database, which is housed at Tufts University, has compiled an interesting database for major foods consumption standardized at the serving size for mostly all countries around the world and over time. And here you can see the top is Lebanon, down is Tunisia, and then in comparison with the world averages. And in red is the problematic trends, which means that, for instance, if you decrease fruits consumption, nuts and seeds, whole grains is good. If you increase processed meats or unprocessed red meats, this is bad. And seafood, if you increase the consumption, is good. If you decrease it, is bad. And basically, we can see trends in Lebanon and Tunisia that were in the red, basically. Less seafood in Tunisia and Lebanon, and decline in non-starchy vegetables, and decline in fruits consumption in Tunisia. Now, if you look at the children, and so we have age-specific consumption, but they, for instance, I picked the 11, 14-year-old standardized estimations. And here we've seen a decline in vegetables in Lebanon in the last 8 years. And in Tunisia, also a decline in fruits and decline in vegetable consumption. Now, just to see how dramatic these shifts are, I took two comparisons between sugar-sweetened beverages and fruits. So for the sugar-sweetened beverages, the consumption has increased dramatically in Tunisia for the overall population and among children. And you can see the increase in Tunisia for children, the dietary intake as sugar-sweetened beverages is skyrocketing in 2018, a dramatic increase. While in Lebanon, it has increased and then declined, probably due to the economic situation, but still it's much higher than the world average consumption. It's still extremely high, specifically for the children aged 11 to 14-year-old. There's been an increase in the overweight and obesity rates in Lebanon and Tunisia, and by substantive rates, especially for children, as you can see in these graphs. And then to conclude, you have also the impact on mortality, which is attributable to dietary composition. This data is from the Global Burden of Disease study, which shows that basically a third of the ischemic heart disease deaths are attributable to dietary composition in Tunisia and Lebanon, which is a very high rate, as you can see, compared to the global incidence. So to conclude with some recommendations, the main recommendation is to establish a food security council in each of the two countries, create new programs targeting smallholder farmers, improve the budget of the Ministry of Agriculture, improving research activities carried out by these official institutions, and several recommendations which are also detailed in the paper. I'd like to thank the team once again, and thank you everyone for listening.